Welcome back to Bio 6612. This week we're going to cover case control studies and conditional logistic regression. So there are a couple different types of epidemiological studies. And in general, epi studies aim to investigate the causes or etiology of diseases and conditions, where often different combinations of circumstances combine to lead to a disease. And these circumstances are called exposures or risk factors. And the main study designs that are used to understand the relationships between exposures and disease are cohort studies and case control studies. So prospective cohort studies, prospective meaning ones that look forward in time, are used to determine if there is an association between certain exposure factors and a particular disease. And a sample is selected consisting of individuals that don't have the disease. And these samples are selected according to some sort of exposure factors of interest. And then that group is followed for forward in time for a given time period and classified according to whether or not each of them developed the disease in that given amount of time. In contrast, case control studies, in case control studies, comparisons are made between individuals who have a disease of interest. Those people are called cases, and those who do not, who are called controls. And in this case, the cases are sampled from a population of individuals with the condition, and controls are selected who do not have the condition. Information about the risk factors between the cases and controls are then obtained respectively for all the subjects. And because we actually sample on the ratio of cases to controls, this is a fixed number, we cannot use this study design to determine the population level of risk of disease. So in general, the advantages and disadvantages of case control studies are as follows. The advantages are that they're much quicker to carry out than cohort studies, and they're also much cheaper. One of the disadvantages are that there can be recall bias about what exposures of interest for that people have been exposed to, especially if those exposures rely on the subject's memory to be accurate. Also, case control studies are restricted to one disease, but cohort studies can collect info on multiple diseases. And also risk, or the probability of disease occurring given a set of exposures, can be estimated from an exposure study, from a cohort study, but not from a case control study. More specifically, below are measures of association between disease and exposures of interest. We have risk difference, relative risk, or the risk ratio and the odds ratio. And we talked about these a little bit at the beginning of the logistic regression weeks. And due to the design of the cohort study versus the case control, risk, all of these measures can be estimated from a cohort study, but only the odds ratio can be estimated from a case control study. And this is always important to keep in mind when you're interpreting the results from a case control study. However, we can still use logistic regression in case control studies to get the odds ratios. If we treat case or control status as a binary response variable, then the logistic regression model can be used to analyze results from case control studies. We just can't use the fitted model to estimate the probability of disease or relative risk. So in the example here, a case control study was designed to investigate whether there's an association between occurrence of cervical cancer, and whether or not women received the HPV vaccine Gardasil. In this study, there are 47 cases, women who had a histologic diagnosis of invasive cervical cancer between 2004 and 2006, and there are 173 controls. These are healthy women who attended the hospital for family planning purposes during the same time period. And then a questionnaire was administered to learn whether or not patients had previously received the HPV vaccine. Here's a table of that data. So just like we have before, we can use this logistic regression to run this model. In this case, I want those who have been vaccinated to be the reference group, so I'm just refactoring that variable. And I'm running a logistic regression model with case or control status as the outcome and against the vaccinated variable. And you get your coefficients, which are the log odds ratios. And you can use the same interpretation of your odds ratio and same Wald or likelihood ratio, hypothesis testing, and all of the same model checking that we've learned previously.